My name is Shelby Shopka, and I'm a fourth-year Bachelor of Science in Kinesiology student, and I had the amazing opportunity to complete my professional practicum at Advantage Sport Medicine and Physiotherapy. This is a multidisciplinary clinic that provides rehab services for any musculoskeletal or sport injury. So anything from shoulder, knee, back injuries to chronic pain or concussion or soft tissue injuries, they can help you out with that there. Although we are labeled as a sport medicine clinic, I still got to see patients of all ages and all fitness levels, which was a great learning experience. Advantage actually has two locations, one in St. Albert and one on the south side of Edmonton, and I spent the majority of my time on the south side. At this location, there was a team of 6 physiotherapists, 1 athletic therapist, and 1 kinesiologist that I got to work with. This was a really cool experience for me because it allowed me to see a variety of healthcare professionals working towards the same goal with unique treatment styles. My supervisor was the amazing Kelsey Fleury, who was a kinesiologist at the Southside location. One of my main roles during Practicum was to teach exercises to clients while educating them on proper form and technique, and overall making them feel comfortable in an exercise setting. In addition to this, I also had the opportunity to take client histories, compile exercise programs for them to take home, chart on all patient interactions on our database, and write a couple blog posts for the website. A really unique aspect of my placement is that Advantage Sport Medicine and Physiotherapy actually has a partnership with HealthPoint Pain, Spine, and Sport Medicine Clinic, which was in the same building as us. Because of this, I actually got to shadow a couple physiatrists and sport medicine physicians, which was a really great opportunity for me to see a comprehensive view of all the healthcare professionals involved in one patient's rehab process. My legacy project was originally going to be a generalized program for non-specific low back pain. However, due to some changes in the needs of the clinic, as well as the COVID-19 outbreak, I was instead asked to provide a presentation on whether or not the clinic should purchase and begin to use a shockwave therapy machine. The clinic's rehab philosophy is extremely active and evidence-based. Therefore, before they bring in a new passive treatment that would cost them a lot of money to purchase, they wanted to ensure that the science behind the treatment was accurate and that it would be effective for their clients to use in the future. I'm currently completing my legacy project from home. However, like every research project, I began with searching for peer-reviewed academic articles and meta-analysis through the library website to see whether or not shockwave therapy is actually effective for clients or not. I also consulted with a couple of the physiotherapists to see what they would like involved in the presentation so that the information I'm giving them is actually useful. I'm then going to be compiling a PowerPoint presentation with speaker's notes because due to the given circumstances, I might not be the one presenting it in the future. As well, I'm going to be making handouts for all members of the clinic who are interested in attending. Through creating this legacy project, I have not only learned about the topic itself, which, by the way, shockwave therapy can be effective for treating plantar fasciitis as well as several tendinopathies. But the thing that I'm going to be taking away the most from this experience is communication and managing information skills. This is because throughout my entire practicum, I've essentially been taking information from school and from the team at Advantage and simplifying it for the general public. However, now this communication style is going to be flipped because I'm taking the academic information from the articles and presenting it to other professionals such as physiotherapists and doctors who are experts in this field. Therefore, I've learned how to make sure my written and verbal communication is professional, academic, and specific because this is a business decision that could affect their company in the future. Looking back, I think that my legacy project process could have been improved if I would have had the same topic throughout the entire semester. However, with the coronavirus outbreak and all the changes happening in the clinic, I completely understand why this new project was more useful to the clinic, so I'm completely fine with how things turned out. Overall, I had an amazing experience at Advantage Sport Medicine and Physiotherapy, and I just wanted to say thank you to all the staff there for welcoming me and helping me learn and grow throughout the entire semester. And lastly, I wanted to say thank you to the Practicum supervisors and organizers for allowing these experiences to happen.